Okay, good afternoon. This meeting of the Board of Health for May 2023 will come to an order today, May 12th at noon on the dot. I will ask for the roll call.
Jamie Steig,
Present.
Avish Nagpal,
Present.
Bernie Dardis,
Present.
Grant Severson, Arlette Preston,
Here.
Kayla Nelson,
Here.
Lynn Telford,
Here.
Nimal Day,
Here.
Tony Grimberg.
Here.
Thank you.
Okay, thank you. First thing on the agenda will be to approve the minutes from our last meeting, which was February 10th. The secretary's draft of the minutes has been sent to the board for your review. Are there any corrections to the minutes?
They look really thorough, so I'll make a motion to approve.
Second.
Okay, all members in favor, please say aye.
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 No nays, motion carries. And I will turn it over to Desi for department updates.
Thank you, everyone. I really don't have much. Otherwise, I was just going to mention as an update on our building rehab that everyone is finally back in their original home. I can't say that all of the work has been completed yet. We still are missing some base rails and different things like that. So it's been a little painful towards the end here, but everyone all nursing is back in their part. We still have some of our emergency preparedness staff over in that PD substation, but we will be kind of staying in there until we can figure out another space for that division. But otherwise, everyone is happily back in their space.
Okay, that's great news. Any questions for Desi until we'll move on with the agenda? I would like to welcome Dr. Chris Tiongson, who will be reviewing Be Smart curriculum from Everytown for Gun Safety.
Oh, yeah, thank you. Oh, PowerPoint.
We'll get the PowerPoint pulled up here and
There
there
we
we go.
All right, well, thank you. My name is Chris Tiongson. I am a pediatrician in Fargo. And thank you for the opportunity to introduce you to Be Smart, which is a talk for parents and other adults to reduce the risk of kids being injured or killed by guns by promoting secure storage of firearms. So I'll go through this presentation as if I were presenting to a group of parents or other adults, not only to share this information with you, but to give you an idea of what a presentation would look like. There are different versions of it that can be delivered, for example, for healthcare professionals, and talks can also be tailored to different audiences. This version is relatively brief, but does contain key information. This talk is not about laws or policies. Be Smart is something that all families and households can do to help keep kids safe. As I'm sure you're all aware, guns are now the leading cause of death in children, more than cancer, car accidents, or any other cause. And with that in mind, we all want kids to grow up happy and healthy. We each have the right to make responsible decisions about how to protect our homes, families, and communities, including whether or not to have a gun in our home. And if we can prevent even one child gun death or injury, it's our responsibility to do so. Be Smart is a program to bring together all adults concerned about kids, guns, and safety. Many people own guns just like many people drive cars, and lots of kids have bikes. Talking about secure storage of firearms to me isn't any different than talking about bike helmets, seatbelts, and car seats. An important part of this talk is making sure that we share the suicide prevention resources. And a few of these are listed on the screen here, including the National Suicide Prevention Line, the 988 Suicide and Crisis Lifeline, Trevor Project Lifeline, and that you can text home to 741-741 anywhere in the United States, anytime, for any type of crisis. So now we'll talk a little bit more specifically about Be Smart. SMART is an acronym for the 5 things parents and other adults can do to reduce the risk of gun injury and death. The S stands for secure all guns in your home and vehicle. M, model responsible behavior. A, ask about unsecured guns in other homes. Recognize the role of guns in suicide, and tell your peers to be smart. So starting with S, secure guns in homes and vehicles. 13 million households in the United States with children contain at least one gun. And the majority of children in gun-owning households actually know where the gun is stored. So what do we mean by securing guns? A gun should always be stored securely, which means they are inaccessible to kids, and make sure that children are never in the presence of an unsecured gun. Hiding a gun is not securing a gun. So what does safe storage look like in real life? Here are some examples on the screen. Locking up guns does not prevent owners from readily accessing their guns. There's a common myth that storage devices negate the self-defense purposes of owning a gun by putting time-consuming barriers between the gun owner and their means of defense. Reality is that there are many affordable options for secure gun storage that provide owners with access to guns in a matter of seconds, while still preventing access by children and people at increased risk of harming themselves or others. Further, it's possible that unsecured guns may actually increase the likelihood of crime and violence through an increased risk of gun theft. Locking up guns will help reduce the risk of firearm suicide, unintentional firearm injury, and also help prevent firearm theft. Hundreds of thousands of guns are stolen every year. It's important also to remember to lock up any guns in cars too. More than half of all stolen guns are taken from cars. Just putting a gun under a seat or in the glove compartment is not secure storage. There are car gun lock boxes available for purchase at most retail and sporting goods stores. Second page also includes some other examples of storage devices. I'd like to draw your attention to the cable locks. You can see the price listed on there, anywhere from $0 to $50. Oftentimes, community organizations or places where you buy a firearm, they will provide you with a cable lock for free. M is for model responsible behavior. Every law-abiding adult has the right to decide whether or not to have a gun in their home, but you can't rely on curious kids to not find the gun. Kids know where their parents store their guns, and more than 1/3 report handling their parents' gun, many doing so without the parents' knowledge. Nearly a quarter of parents did not know that their children had handled the gun in their household. It's always the adult's responsibility to prevent unauthorized access to guns, not a curious kid's responsibility to avoid guns. Talk to your kids about gun safety, but remember, that's a precaution, not a guarantee. One study found that young children who go through a week-long gun safety training are just as likely as children with no training to approach or play with a handgun when they find one. Modeling responsible behavior means that smart adults make sure that kids don't have the opportunity to access guns. That said, you can't control the environment that your child is in all the time, so you should teach them not to touch a gun if they come across one, real or pretend, and give them the tools to get out of a dangerous situation and alert an adult. As an adult, it's your responsibility to do everything you can to prevent them from getting in a dangerous situation to begin with. A stands for ask about the presence of firearms. There are approximately 4.6 million U.S. children living in a household with at least one loaded, unlocked gun. That's why we need to ask about firearms in other homes that your child visits, the A in SMART. Parents often ask about many other things before having a child over at another person's house. For example, if your child has a cat allergy, obviously you would ask if there are any cats around. Just like you might ask about whether there's a pool, If you are going to be taking any trips, do you need to leave your car seat for that family, or do they have one? Who will be home supervising the children? Particularly for older kids, you wonder about, any potential access to alcohol while they're over at the house. And then maybe what are their rules for TV and screen time and electronic video games? Asking about guns in someone else's home can feel very awkward, though. And it should be as natural as just asking about any other of the safety issues that I just mentioned. One way to make it less awkward is to have it be through text. And on the screen, there are a couple of examples of how a person or a parent can ask about that. The R stands for recognize the role of guns in suicide. Access to a gun can mean the difference between life and death. As our children get older, you may need to consider taking another look at your storage methods. If you've just been using a simple cable lock, you may need to think about getting a gun safe. We all know that how curious kids can be, and as they get older, they can become more resourceful and can get around your initial means of securing the firearms. Also, if you know that you have a loved one in distress, you might also consider temporarily removing a gun from your home. Why would you want to do that? Well, it's important to consider that firearm suicide is uniquely lethal. 90% of attempts at suicide with a gun end in death, and half of all U.S. suicides are gun suicides. 70% of people who survive a suicide attempt will never attempt again, so that is an opportunity to give people another chance. So if you do consider temporarily removing a gun from your home, how can you do that? Where could you bring it? Local law enforcement may be willing to temporarily store your gun. Some licensed gun dealers or gun ranges may be also willing to do the same, or you could store your guns at the home of a friend or a family member. In order to help manage the risk for that friend or family member, you should lock your guns first before the transfer and not provide the key or code. Most people who attempt suicide do not die unless they use a gun. Again, 90% of suicide attempts with a gun end in death. The other scary part is that one study showed that kids spend only 10 minutes or less thinking about attempting suicide before they actually do it. 10 minutes. Putting time and space between a person contemplating suicide and the means of doing so can make all the difference. The National Youth Survey conducted by CDC showed that 20% of high school students had seriously considered attempting suicide within the last year. One study showed that 41% of adolescents in gun-owning households report having easy access to guns in their home. Research shows that secure firearm storage is associated with decreased risk of child firearm suicide. And again, once again, the resources for suicide prevention are on the screen. In addition, there are some additional signs to look out for if you are concerned about a loved one. Prolonged sadness and depression, changes in mood or behavior, hopelessness, sleeping too much or too little, withdrawing or isolating, aggression or agitation, increased alcohol or drug use, and talking about killing themselves. T is the last letter. Tell everyone you know to be smart. Sharing the message with others helps protect our kids. Thank you for the opportunity to share this with you today. I hope that more parents and adults will have the chance to learn about secure storage to help keep our kids in our community safer.
Any board members have questions for Dr. Tiongson?
Madam Chair, I have a question.
Thank you.
So on my annual exam, there's all kinds of questions about safety that are asked. But I don't think I've ever been asked about gun storage. Is that something that the medical community is considering?
It is a part of the American Academy of Pediatrics recommendations, just like bike helmets and everything else, to ask about other safety concerns. So that is something that is has been recommended by national bodies. How much each practice does it varies.
One other question, if I could, Madam Chair.
Sure.
So how are you distributing information about this presentation?
What I have delivered it to school groups and other community situations, as well as shared it with other members of the medical profession.
Okay.
I do think there's opportunity as a community to commit to a certain approach, and I think Be Smart is really simple. It stays away from the laws, so this might be more of a conversation for City Commission as far as the community approach to it. I know that the National PTA Convention last year, the Institute for Healthcare Improvement Conference, end of last year, both had key sessions on preventing death, injury, and death. So it has to be a community approach. It's not just the schools, it's not just providers. But I just really appreciate the simplicity of this and the applicability to everywhere. And also as a parent so we do not have guns in our home, but as a parent, I had thought I would put my kids through hunter safety because I wanted them to know how to handle guns safely if they were to be in that situation. And this taught me that that's not really the right approach. And it's about advocating for this approach where we put the responsibility back on the adults and the gun owners to keep them from being stolen or in the hands of the wrong people.
I just wanted to give a little background on this too. Thank you, Dr. Chionson, for your willingness to come here. But we've been having discussions, obviously, at the health department. We know this is a national issue, and we certainly have programming within the health department right now where we're addressing, the suicide, concerns. But we've never really gone down the road of the gun and the gun storage. So I think what we're looking for today from the board is like, after seeing this, messaging, is there a way for public health to kind of incorporate this into some of our programming? And if you have any thoughts on that, certainly we have maternal child families that we serve where, there would be a potential to do some things there. We deal with the schools, different things. I guess that's really what I wanted, was some feedback from the board on, is this an important message that we should be getting out? And then even just some ideas that you would have on how you think that might look within our role within the community.
I think, given guns are the leading cause of death in children, I think we have a responsibility to do that. Since it's surpassed everything else, it's pretty important right now.
I have a question. Yes.
I would tend to agree, and I think highlighting how big the problem is in terms of basic statistics on the percentage of accidental deaths in kids, or intentional or unintentional, that might be a part of strategy too.
Well, first and foremost, I just want to say thank you for that presentation because it's so crucial, and it's speaking on the facts. You put in a lot of research, and you you put in like data about information regarding travel projects. Last time that I heard about the travel projects was when I was in New York, and it was the spokesperson that was presenting, and that's how I get to meet him. So I heard so much about the travel projects, and then also to just you presenting the data. Especially the statistics and the percentage of the suicide. I hope that our community can see how important it is to discuss about gun violence in our communities and how we can be able to incorporate this, or just taking all these information from from this presentation. It's crucial itself because it's just me looking at this, about 20% of high school as a board member in Fargo Public School. It scared me because I want to see those students to come back to school every day. and not thinking about committing suicide and so many things. And then also too, I'm just wondering, have you connect with Mom and Demand? Mom and Demand Action or something like that. I hope I'm saying it right,
Yeah,
because
they're-
they are one of those people, group.
That's a group in the Fargo-Moorhead area
Yeah,
that is involved in gun violence prevention, yes.
Yeah, and then far as for public health, definitely, you know, any way to be able to save people in our communities is always welcome in my book. It doesn't matter how we are in our community. You're a Republican or Democrat. What matters to all of us is our community safe? Can we walk down the street and can our kids be safe, you know, and instead of calling 911, you know? I think this is a great approach. We just need more people to stand behind you and support you on this. Thank you.
I agree with Kayla. We have a responsibility, no matter what approach we take, we have a responsibility to reduce gun injuries and death and prevent suicides. I think that starting with public health, whether both with your patients and then from a, public health campaign perspective, this is important information. To Naimal's point, you can't do it by yourself. I would love to see this be something that our healthcare organizations use, law enforcement, our public schools. Really a unified approach as a community. And like I said, with the simplicity of it, I do think there's opportunity there for the community to adopt, Be Smart as our platform. But I think public health, utilizing it is a good start.
What I like with this so much is that it is such an educational approach. And, I'm sitting here thinking the same way you were, Lynn, which is how could we at least begin with city staff, city departments, and maybe, Desi, we can talk a little more about that. Within public health, with visits that are happening, but perhaps it could even be broader in some kind of campaign, internally and externally. So maybe we can visit a little bit more about that too.
Just as a thought, part of the public campaign, maybe visiting with the sporting good owning stores, when your slides had, almost free locks, I bet if there was a conversation, they would at least be interested in maybe through that campaign providing free locks too. Just a thought.
That's an excellent idea. Thank you.
Yeah.
And I have heard that places like Shields will partner on education on the safe locking of guns. So that is a great idea. Okay, well, more to come on that. Thank you for the presentation. Very, very impactful. Okay, next item on our agenda is the Faces of Suicide video. Does anyone want to provide background on?
Commissioner Preston, is that something you wanted to share? So this was an event. This video was created as a partnership between Fargo CAS and the Police Department and the 463 Foundation. Who am I missing? And so they worked with families who have been touched by suicides and created this very moving video of personal stories. And so we held a premiere at the Fargo Theater and had the mayor gave remarks and Commissioner Preston gave remarks and family members and the other groups of the partnering organizations. And it was just a really touching event. And this video is then being shared through social media networks, and it's just been a really good partnership. The other piece of this is that the city comms team was instrumental in helping us partner to make this just a really quality promotional type of PSA for this platform. And so I wanted to say thank you to them too for all that they do for us. But we were just going to show the video I don't know if,
I apologize. I think I missed a beat here. But you did a great introduction. Maybe I could just add, you know, these are heavy subjects, both of these. And the video, as you watch it, it's very moving. And at the news conference, there were a few family members there that had been touched by suicide, by a child's suicide. And yeah, I think this video portrays that in a very touching and a very emotional way. So go for it, Justin.
I'll just add too that this went out to all the Fargo Public Schools families as well. It went out in the newsletter yesterday to our district, so.
There is no one look of suicide.
Liam Med, age 15, son, brother.
Suicide is the second leading cause of death for 10 to 24-year-olds in North Dakota. 75% of all suicide attempts think about it for less than 1 hour.
Bella Krajcek, age 14, daughter, granddaughter.
Since 2007, nationwide suicide rates have increased by 56% for 10 to 24-year-olds.
Caden Steiner, age 15, son, brother.
It's likely that someone in your family or friend circle is contemplating ending their life. Warning signs can include withdrawing from activities, a change in eating habits, a change in sleeping habits, more irritable or emotional than normal. They may talk about shame or guilt, not wanting to be here, being a burden or a mistake, being trapped, dying, or what happens after life.
Eli Johnson, age 19, son, cousin, friend.
Immediate life stressors matter. Relationships, finances, legal issues, medical prognosis, public humiliation, shame.
Nolan Wilson, age 11, son and brother.
You have value. We care about you. Reach out to someone. There is no shame. No feeling is final. You're not alone. There are resources. Help is available. The National Suicide and Crisis Line is 988. In an emergency, dial 911.
Very well done video. And I know Arlette mentioned that this is a really heavy topic, and I might ask Dr. Newman or Dr. Tiongson to weigh in on this, but following the death of Nolan Wilson, who is a fifth grader, and my son's a fifth grader, I decided that I wasn't going to avoid having the conversation with my kids who are 8 and 11, so it definitely felt heavy to sit with an 8-year-old and talk about it. But I think there's this perception that if you talk to kids about suicide, it gives them the idea to do it, and that's not true. Talking about it helps them understand that they're not alone and that other people experience similar things. So I don't know if Dr. Tiongson or Newman have anything, for that piece about having the conversation with kids.
No, I think you stated it really well. I mean, at our clinic here at Sanford, we start screening for, we do something called a teen screen that screens for anxiety and depression. And a part of that, we tend to ask about suicide if they score a certain amount. And that starts typically at age 12 or 13 in our patients. So I don't know, do you have anything else to add?
So it's a heavy topic, but everyone has mental health. So it's important that we talk about it so that those who are experiencing a crisis don't feel so alone. So thank you for the video and raising that awareness. Any questions for the team? Okay. The next order of business is an update on Credible Mind.
Yep, that was actually a nice segue into services. So Credible Mind contract has been signed. We've had our first meeting with Amy, who was our engagement specialist. She's been super helpful as making the website ours a little bit. So right now we're at the process of like trying to identify resources and all these things that we want to have on there and topics that, you know, we would want to highlight and maybe put at the higher end list. We are talking about coordinating a little bit with the City of Fargo comms team to do like a little internal launch as we're kind of like beta testing as we go. So they'll help us with that. They've been super helpful, like with the videos. Brian, Ryan, Peter, Ben, Greg, and Katie have all helped with all those events. So they've been great with that. So as we do Credible Mind and we get into the launch, it's going to be really exciting to see how we can all coordinate too.
Justin, for
Yeah.
those that are new up here and for us that have short memories, will you please describe what this is?
Oh, sorry. Yes, I apologize. Sometimes you're in it so much you just start to like talk shop. So yeah, Credible Mind is a mobile platform that online platform that you can use and do mental health if you want assessments, if you want to do podcasts and information, if you're feeling down about things, if you are feeling suicidal, there's information on there. There's humongous trove of media for people. If you are, you know, sad one night and it's 2 a.m. and you need something and there isn't somebody to call, there's information on there you can go and look at. And you can sign up and you can create an account that's 100% confidential and private. We won't even see it. We'll only see like users counts. That's it. So we won't have any other the back information. And there are varieties of topics. Again, if it's for depression or if it's job burnout, if it's you just need time in nature, those are kind of things, and you can get more information about medical treatments if you want before you talk to your doctor. If you want to inform yourself, you can look some things up on there, and they've all been vetted and looked through, and they are verified. So, you know, one of the obviously problems we've had with mental health and public health sometimes can be misinformation. So it's addressed with it, and it's great.
I was just going to add too. So again, he mentioned vetted, but so this is based on an evidence-based, it's kind of a self-care information platform. And so really it is people, when they did their research, they found, you know, there's a whole lot of us out there that just, you know, we may not need to talk to someone, we may not need treatment options, but what we might need is some really credible information where we can go and seek ways to do self-help, self-improvement things, strategies. And so that's what this really does, is it gives you access to all of these resources that have been vetted by public health physicians and clinicians and epidemiologists and all of these things. So you don't have to worry about what you're going to get if it's credible or not. And so I think if people can get to the point where they can better manage and find the resources that they need, and many, you know, in that young adult, they don't want to call someone, they don't want to talk with someone. And so this is just one of those really good ways to address kind of population mental health within our community. So I think it's going to be very valuable.
If I recall, we had a demonstration of it at one of our meetings, and there are ways they walk people through coping mechanisms, because we know healthy coping mechanisms is a really important way to manage a crisis. Also, we get people, if people do reach out for help and we schedule them an appointment that's 2 months down the road, then they sit and wait. And so that's something that can help them learn those coping mechanisms in the meantime. So we could probably send if there's a demonstration or an overview to the other board members who maybe weren't here last year when we had that demonstration.
The platform will also have all of our local resources kind of loaded into that. So it would be, whether they do an assessment and they're just looking for self-help material. If their assessment shows that they need more help than that, it directs them that way, and then it directs them to that resource page so they can then reach out for whatever level of care that they're seeking. And the contract will have this secured for 2 years with this platform.
So I wasn't here when you guys did the demonstration. So where can I go to get this information? Or
We can send it out. We'll send out the video link. It's from a previous Board of Health meeting, so that's no problem.
Yeah, we haven't officially launched the website, but we can certainly, that's what he talked about. We're kind of going to do a little test run. So we're working with the person to get everything set up for our local site. We'll do a little internal release within the city, and then we'll have all of that public media release type thing so everyone knows that it is available and ready for use.
wonderful, because I thought it was already released, so I need to know where I can get the detail. But thank you, I appreciate it.
Do you have an estimated timeline or goals for launching?
I will say Amy, the engagement person, has been super responsive. So we've gotten some things pretty fast. We're just coordinating internally to get the resource together. And what do we want to put on there where they're helpful and it's not just overwhelming with every kind of resource we have. So that's where we're kind of at in our planning for the rollout, like what is beneficial, and we can add to it as we go as well. So it may be one of those things that we just need the communication back from people. What do you want on here? What is helpful?
We also need to reach out to all of the local providers and make sure that they are good with the platform, good with putting their information on there, and make sure that, we're all, but I don't anticipate, I would say mid-summerish probably in there for sure. We would probably have things up and ready to go. And our 2 years doesn't start until we're formally open, so that's the good news.
Okay, any other questions or discussion on Credible Minds?
My question would be, during a number of the presentations, the nomenclature that's been used is the city. Is it going out to the county as well as the other entities, other schools, other than just the city of Fargo?
It's all of Cass County.
Thank you.
Yeah.
Okay, hearing no other questions, we can move on to the next item of business, which is the harm reduction team update.
Hi, everyone. I'm Jan. I'm Director of Harm Reduction Programs for Fargo Cass Public Health. First, I'd like to give you a quick summary of some of the activity at our newest and probably most visible program, and that's the Downtown Engagement Center. In April, we averaged about 88 visitors a day and saw more than 430 individuals come through the door for various services. We have reduced the hours of the hours of operation at the engagement center. It was operating 8 to 8, and it's now operating 8 to 5, just due to staff shortages and a number of other issues related to that. I don't know that will impact or have much impact on the numbers of people that we're seeing walk through the door every day, as most folks are coming through the door before 5. A number of those folks are coming in to see Homeless Health Services, which operates from 8 until noon each day. Otherwise, we have many community-based services on site each day, and we also have a number of services that are housed right at the engagement center, and that would include Presentation Partners, Native Inc. out of Bismarck. They provide care coordination. Of course, Homeless Health Services, which is part of Family Health Care, and numerous others. So it's an exciting time. We're seeing a lot more activity. In addition to that, I'd like to make you aware of 2 new positions that we have. Both positions support our efforts to try to move our community toward more sensible solutions and more responsible reactions, I guess, to the various issues we face regarding homelessness and behavioral health throughout the community. First of all, we have the program operations manager, and that has direct oversight of a number of the programs under the harm reduction division. And Jordan Joshua, who is behind me, has taken on that role. Prior to becoming the program operations manager, Jordan was responsible for the management of the withdrawal management unit. And he's been with harm reduction for close to 11 years. And next to me is Chandler Esslinger. She is the new community liaison. Her role has been evolving fast, and she's been in the role for 2 months. And her primary responsibilities, first and foremost, is to work on a project that is hopefully going to lead to having a dedicated amount of resources and a plan for overflow specific to homelessness. We have, it's not necessarily winter overflow, it's shelter overflow, because we know that the system has, the burden has increased for all of the shelters in the community. So Chandler is working on that. She also is working on building programming into the Downtown Engagement Center. For example, the various community members and agencies that have expressed an interest in coming in and providing anything from wellness activities to cultural activities, skill building, employment. We have a lot of interest in the community and helping us achieve some of our goals with the Engagement Center. Additionally, Chandler is facilitating a conversation throughout the community regarding the adoption of, or promoting the adoption of, a crisis tool that SAMHSA has put out. I know that there's a lot of concern. We've had meetings with people throughout the community, Moorhead, Fargo, West Fargo, regarding the lack of crisis response, especially when it comes to mental health. And we're trying to work on that. Chandler has a huge role in that with facilitating those conversations. She's great at it. Do you have any questions?
I know our local emergency departments get overwhelmed with, you know, the acute needs for mental health crises. So I think any work we can do in the community to give other options besides the ER is good. And so thank you both for the work that you're doing in those new roles. Any questions for them?
Madam Chair, if I could just say, this program is relatively new to the city, and I just have to commend staff. We have experienced, I think, some challenges, especially since COVID, and staff are working hard to try to find people housing as well as connect them with services. So I want to add my thank you as well.
And I think I echo that thank you as well. Has it been 2 years? I wanted to give a guess. 4 years? When did you start the Downtown Engagement Center?
It's actually, the Engagement Center has operated since about late March, early April.
Okay.
That's when we stopped providing overnight services for quarantine and isolation related to COVID.
Okay.
But we've been in the building longer than that, of
Yeah.
course, as part of our response to COVID. And we actually had the shelter there for a short time as well while we went through a improvement project.
Okay, well, good work, and you continue to have our support.
Thank you.
The next order of business is budget.
Hello. As you may or may not know, the city of Fargo a couple of years ago decided to push the budget process for the following year up a month or two. So we already started working on 2024 budget in April. And we are still working on it, though it had to be sent to the City of Fargo Finance Department last Friday. So we have submitted our numbers to them, though we're going to have a few changes as the next month or so rolls around. I think that's the expenses on the front page there that you're looking at. The numbers that were sent earlier this week, we revised just a little bit. You can see at the bottom of the page, we changed from 22 FTEs to 19 in a request for moving temporary seasonal staff to full-time positions. In our budget itself, all the highlighted items, the larger items in those day-to-day expenses are either covered by our grants, or one of them in particular is a new one we added, which is called guest bus and hotel, and that is set up from donations from anywhere where we get those donations, and we use that for bus tickets and airfare tickets if someone needs to, they're homeless here, but they have family elsewhere in the country. We get those tickets for them and get them on their way. So our operating day-to-day expenses are increasing by $320,000. And then we are also additionally asking for payroll requests of an additional $3 per hour for our harm reduction advocates. The jail is getting paid out of grade pay at the moment, but that's covered by Cass County. And then our capital requests currently include a software upgrade to our environmental health software. So that's our expense budget. Any questions on that? Okay. The revenue.
We do have a question.
Okay.
So I apologize, Melissa, I might have missed it. So the temporary seasonal got moved up into the full-time line here, or?
We're requesting that line item at the bottom, you see 1.3 million is a request of 19 full-time temporary.
Down there.
Yep.
Okay.
Yep.
Got it.
So that, the bottom line is 16 million, which last year was 13.7 for the expense budget. And then, there's no other questions on that, or do you have one more? Go ahead.
Yeah, just a quick and simple one. I see that most of your differences between pharmacy and Ryan White program.
Yes.
So, for those of us who work with HIV and vulnerable populations, Ryan White funding is a blessing for us. And it's amazing how many services it provides, and I'm stunned to see that you can do it within the stated budget. But I see that we are running a deficit over there. I was wondering if it's directly connected to the cost of the medication, which I'm presuming is the primary expense that's covered by Ryan White.
The pharmacy line item that we have in here, this increase is actually from our substance abuse grant that we have. We provide naloxone. That's what that's for. The Ryan White expense is any expense that they have, whether it be medical, dental, vision, those all are under that. Our grant this year is $300,000 that we just received.
Yeah.
And that's money that comes from the state, and so it's all covered, it just has to be reflected because our grant got increased by 100,000, so that's why that difference is in there.
Right. What I was getting at is that we as healthcare systems, one of our topmost expense is pharmacy cost, considering the cost of drugs that's escalating pretty rapidly. So I was wondering if Ryan White is facing similar problems yet.
I don't know if the clients are having that issue or not. I don't see a lot of that expense.
Yeah.
Yeah, mostly for the grant purposes for us with the state, it's not covering their HIV medications, it's covering other healthcare costs or, that may impact them, or even housing or different things like that. So it pays the other kind of expenses in their lives, not the HIV treatments.
I see. Thank you for clarifying. And then last question is, do you cover PrEP under Ryan White too, or has that been under discussion if it's not covered?
I don't know if we've seen that yet.
I don't think that's under Ryan White, but I think we have avenues in the clinic. If someone cannot, afford something, we can work with them on that.
Thank you.
We just started PrEP not that long ago. Pretty new. Okay, and on the revenues, so just before we came, we were notified of our state aid that is smack dab in the middle of this worksheet on the revenue side, increased from $564,000 to $881,000. So that increased our overall revenue budget, all the funding that comes in across the board, from $65,000 to $383,000. There was a line item missed when I had sent the revenue sheets out earlier, and that is a new grant that we got, or it's not a grant necessarily, but it's from the VA to triage shelter, those that are leaving the VA at the end of the day, and then the harm reduction staff are triaging them. And so we are getting paid $49.32 a day, I think, to work on that program, have that capability for them. We also have a few line items in that top section under grants that some of those got extended by another year, and so we haven't figured out what those numbers are going to look like, and so I left all of them off currently. They can be adjusted when the actual contracts come through, so there will be more adjustments coming to probably both of these bottom line numbers.
Just to give a little more backstory. So historically with our budget, we've tried to be very frugal in our requests. We have a lot of grant funding historically. But with this budget, what's been challenging is obviously our harm reduction division has grown. That we have grant funds that support the two positions that Jan was talking about, but overall, you know, we get things added to the harm reduction budget. Well, no, we get the responsibilities added to us, but we never get anything added in our budget. And so we are trying, with the guidance of Commissioner Preston this year, to try to figure out exactly what our expenses are to run those programs. And so historically, we've had a little bit of a temporary seasonal budget, and that's where all these positions are. And so, you know, the reality is that we either have to do the program safely or we don't do the programs. And so we're trying to identify the staffing needed. So we do have a pretty high budget ask this year of 2.3 million for the various requests. Probably 2 million of that is in the harm reduction division. We have already been asked to cut that back, and so we are having to make a secondary request and to try to cut that by half or whatever we can. And so the challenge with that is that there's certainly we can pare things down, but you get so far down and then we're going to have to make choices about having a program or not having a program. So, you know, currently we've cut down hours at the deck. I mean, yes, it's a staffing thing, but it's also, we're trying to work in a budget, you know, because we're a little bit over budget this year with some of our services. So the deck, we've cut down time. Withdrawal management, we've cut down time. And so going forward, if we're going to do anything less than this 2.3, that certainly those services are going to have to stay at a lower response level. And if we have to cut any further than what we think we can cut, then we're going to have to look at cutting programs. And so it's hard because we've been tasked, everyone looks to us within the community, and we are really, you know, we have really trained staff that provide kind of that lower level of response. So if you take out some of the programs that we do, then you are going to be taxing more on police and fire and hospitals and all of that. And so that will be our challenge in presenting our budget this year. I just wanted to have you have some awareness of a little bit of what we're up against.
Madam Chair. This is my first time of seeing the budget this detailed, Desi. So if the city commission and the Cass County Commission approved, I'm just making this as a scenario illustration, the third page of the projection for 2024, let's just assume that all things being standpoint of discussion were passed, and then your note of approximately a little over 300,000 increase in state aid.
Mm-hmm.
So then if you go back to the first page under change, you got a net 320,000 above right now with a projected 24 budget. So with the increase in state aid, you'd be whole for the year? I mean, just from an illustration standpoint?
Is that, you mean if we would get our whole granted 2.3, that piece of it?
Yeah, I'm just looking at your 24 projection with City of Fargo, Cass County, and state aid, and then grants. You noted that the news here, like within the hour, in the morning, you got an increase of plus 300 and some $1,000 from state aid, you know, under that illustration, and you go back to your first page under change, your expense budget, 22, 23, 24 projected, and then you've got to change that, and the total of that is 320,000. It looks like a positive over right now. That is an area you're focused on to try and close the gap. But if the news from the state closes that gap, again, if everything were approved, it'd be whole for the year.
Yes.
Okay.
Yeah, and then actually what this 2024 request does, if we are granted everything, then we go back to the deck being open 8 to 8, and we go back to withdrawal management being open 24 hours, and yeah, that's where we would really
Sure.
that's where we're going to make the most impact in, you know, like Jan said, that we're working on this crisis response within the community, and we're supposed to kind of facilitate and lead that. And the only way we can do that is if we have kind of that full cohort of operations to meet the needs on our end, and then work with community partners. And it's all going towards long-range solutions. So we're certainly hoping with the steps that we're doing, you know, yeah, it's our dream to decrease and do away with homelessness and all of these things, and to help people on their substance use journey and all of those things, but it's hard to do if you don't have a full staff.
Sure, yeah, just an observation, this looks like a very delicate budget to manage and administer because of the various moving parts, so congratulations for managing what seems like, to me, a very somewhat complex model.
And we also have, you know, grant amounts also that we don't know at this time, but our commissioner instructed us that we're not supposed to look for revenue that's coming in and base our budget on that. So, but we do, you know, we know there's a workforce grant coming from the state for local public health, and there's some of the mitigation dollars from the opioid settlement are going to help with some of our harm reduction activities. And so there's pockets of money that will be coming in to support the budget. But we were looking at it from a, like, these are the necessary services that we need to support as the health department, so.
Right, because you're not guaranteed grant dollars, and so then if you base your budget on getting them and then don't get them, then you have to cut, so.
So, Madam Chair, if I can just pipe in a little bit here. One thing that's different, that the health department's budgeting process is different than other departments in the city, and that's what Desi, I think, is trying to is referring to, and that is needing a realistic expense budget so that we know what we're dealing with. And the revenue budget, now I'm not fully understanding whether this does not reflect all of the perhaps projected grant dollars coming in. Is that correct? So the budgeting process here is different than what I'm used to, which is you have a budget and then you watch your actual. And if the revenue isn't coming in as you have budgeted, then you address it. But I don't think any of us on the city commission had the intent that, like, for instance, harm reduction, which is probably the largest bite here from the general fund, that harm reduction would go away. So, you know, I think it's a matter of a mindset and translating that into the budgeting process and trying to get the health department treated probably the same as other departments. There's a lot of departments that get grants, and they have their expenses up front and projected revenue up front. And then you watch both of them through the year, and if they aren't matching up to your projected, that's when you deal with it. So hopefully we will get there.
Well, thank you, Arlette, for the advocacy that you're doing on the commission side for them. Questions or discussion on budget? Yes, Bernie.
I commend you for trying to do a budget when you don't know what your revenues and your grants are. And you're doing that for us, quite honestly. Let's be honest. And thus, because you're identifying those projects that you hope and wish that will fund, and that you'll have enough revenues to whether extend the hours or whatever. So this is an extremely difficult budget to put together when you're all the unknowns. But it helps us understand what your priorities are. So no apologies needed for the way that the budget looks today.
Okay, any other discussion? Thank you for the budget review and good luck as you continue to work on that. The next order of business on the agenda is a health officer report with Dr. Newman.
Good afternoon, Madam Chair and members of the board. I believe I'll be your final presentation here today. I just wanted to use my time for the health officer report today to update you on the expiring of the public health emergency, both on the international level and on the federal level, and what that might mean for us here at the state and locally. I know I've been asked a lot about it in healthcare and what it means for us in public health. So to start globally, on May 5th, the World Health Organization declared the end of the public health emergency of international concern. So the emergency committee here stated these 3 reasons: that COVID-19 is not unusual and unexpected, cross-border transmission can't and won't be stopped any longer, and COVID-19 does not require a coordinated international response. So a public health emergency of international concern, just for a little background, is a key legal mechanism within global health security. When we implement something like this, the hope is that it catalyzes timely action to kind of limit societal impacts of emerging risks. And the end of this means the 3 things I listed here. So we will see the end of mobilizing international coordination, the end of streamlining international funding, and the end of accelerating the advancement of the development of things like vaccines, therapeutics, and diagnostics under emergency use authorization. So essentially, the WHO in its press conference said they now see COVID-19 as a threat in like our usual circulating infectious diseases. It's kind of viewed as an endemic state of predictability where we will still see cases occur, but they just aren't viewed as urgently. And then at the federal level here in the United States, based on current COVID-19 trends, the Department of Health and Human Services actually let the federal public health emergency expire yesterday on May 11th. And while our nation's response to COVID-19 will obviously remain a public health priority, the Biden administration and other experts believe that we are just in a far better place than we were 3 years ago, and we can transition away from this emergency phase. And so over the last 2 years, we have effectively implemented the largest adult vaccination program in the United States history, with nearly 270 million Americans receiving at least 1 COVID-19 vaccine. And as a result of this and other efforts, since the peak of our Omicron surge at the beginning of last year in 2022, you can see the statistics here. Our daily COVID cases are down 92%. COVID-19 deaths have declined by over 80%, and new COVID-19 hospitalizations are down nearly 80%. So the U.S. government has really stated that over the next few months, they will transition our COVID-19 policies as well as our current flexibilities enabled by the emergency declarations, and they plan to work really closely with partners such as state public health, local public health, and others to ensure that this is a safe transition. So I thought it might be easiest to talk about what will not be affected by this ending first. It's worth noting that an ongoing COVID-19 response is not fully dependent on a public health emergency, and certain flexibilities that were afforded by this will actually remain. So you can kind of see things I wanted to highlight here. COVID-19 vaccines and treatments will still be widely accessible for those who need them. There will also be continued access to pathways for emergency use authorization for many different COVID-19 products. So things like tests, vaccines, and various treatments. So you can still do EUA through the FDA. Also, major telehealth flexibilities will continue to exist within Medicare and Medicaid. That was a big sort of looming question for us in healthcare. The process for states being eligible or having their eligibility redeterminations for Medicaid will not be affected. So this was a big one. During the public health emergency, Congress had sort of provided extra support to state Medicaid programs by substantially increasing the federally matched dollars that they were receiving. And they provided that they agreed to certain conditions. And then Congress actually agreed to end this condition in March of this year, independent of how long the public health emergency remained. Another one here, access to buprenorphine for opioid use disorder treatment and opioid treatment programs. So again, early in the pandemic, we were seeing Substance Abuse and Mental Health Services Administration. They released guidelines allowing patients to start this drug via telehealth without a required in-person physical exam first. And this has been proven to be so safe and effective in engaging people in this type of care that this flexibility was actually made permanent at the end of 2022. So that will remain. Access to expanded methadone take-home doses for opioid use disorder treatment will not be affected. That's good news for us in public health. Again, early in 2020, federal agencies allowed an increased number of take-home doses to patients taking methadone. And then throughout the pandemic, research and feedback of programs like this demonstrated that this flexibility has allowed people to stay on treatment longer, to support their recovery, and it's actually not resulted in an increase in methadone-related overdoses. So for these reasons, it was announced that this flexibility will remain. Other things not changing in regards to monitoring. So our wastewater and genomic surveillance will remain, and this allows us to track variants and transmission. And then our emergency room data, which is one of the best early indicators of state-level transmission that we use. So what will be affected, or what can we expect to see changing? Many public health emergency allowances and policies have already been made permanent or otherwise extended for some time. However, others will expire, and we can expect to see some of these changes in the coming months. So I've tried to list ones I found important here. Certain Medicare and Medicaid waivers and broad flexibilities for healthcare providers are no longer necessary, and those will end. Coverage for COVID-19 testing for Americans will change. Reporting of COVID-19 lab results and immunization data to the CDC is changing. Certain FDA COVID-19 related guidance documents for industry that affect clinical practice supply chains will end, or they'll be temporarily extended. And then the FDA's ability to detect early shortages or critical devices related to COVID-19 will now be much more limited than we saw during the emergency. Public Readiness and Emergency Prepared Act, or what's known as PrEP Act, liability protections will be impacted. And then just the ability of healthcare providers to safely dispense controlled substances via telemed without this in-person interaction is affected. However, it's anticipated there will be rulemaking with these purposes to extend these flexibilities. And again, as for monitoring, we can expect some changes. Our hospitalization data will remain actually for another year through April of 2024. However, the frequency of that reporting will change. And again, this helps us track severe disease in communities and states. Our death data will remain, but the data source is sort of changing for that. It will look a little different. And then the last three I kind of view as things that are changing a lot. So our test positivity rates, which is one of our earliest metrics of transmission that we use, we will no longer see this at the national, state, or countywide level. Negative tests will no longer have to be reported as well, but some pharmacies may still choose to report this. Cases will actually be dropped completely. This kind of makes sense given all the use of at-home antigen tests. And then vaccination coverage will be spotty at best, I said, and the frequency of these updates will also change. So what does this mean for us here locally? Really not a lot. Most of the changes within our agency have already happened with the way we're standing down from most COVID operations, and everything that's kind of left, we've incorporated into our normal duties of our staff. But just for some questions for the public, can I get a COVID-19 vaccine? Yes, we have COVID-19 vaccines available by appointment, only in our immunization clinic in our main building, and appointments can be made by calling the phone number here. Can you still get COVID-19 tests? At-home test kits are available at our information desk, at our main Fargo Cass Public Health building. Our hours are listed here, Monday through Friday. And then just, are there other locally available COVID-19 resources? Yes, please visit our website. I don't know why it's blurred out. You can't see it there, sorry. But our Fargo Cass website, just to learn, we have various resources there about medical, mental and behavioral health, food assistance, nonprofit business resources, as well as we have translated resources for various populations. And you can always call or email us anytime if you have questions regarding COVID-19. With that, I'll take any questions or discussion.
Questions or discussion?
I think you did great. I figure you figured it out that I will be asking you a question and you put them there.
That whole slide was for you.
Thank you. I appreciate it. You made my job so easy. Thank you. I don't have a question. Have a good weekend.
Thank you.
Okay.
Thank you very much.
Yep, thank you, Dr. Newman. That concludes our agenda. Do we have anyone signed up for public comment? No. Let the record show that there were no public comments. There being no further business, we will adjourn the meeting at 1:11 p.m. and the next meeting will be August 11th. Have a nice summer now that it's here.